Hi everyone, this is Divya from Quickmommyhacks, and today we'll talk about infertility and IVF. And to discuss this topic, I have Dr. Urvashi Sehgal with us.
Dr. Urvashi Sehgal is a senior consultant in gynecology for the last 25 years with special interest in IVF and high-risk pregnancies. She is the director at Phoenix Hospital and visiting consultant at Lafame, Apollo Cradle and Rosewalk Hospital. She is the recipient of the President's Gold Medal MBBS and Distinguished Service Awards from Delhi Medical Association and Indian Medical Association. She is the pioneer of first water birthing technique in India.
So, hi Dr. Urvashi, how are you?
I'm very well, thank you. How are you, Divya?
Thank you so much for joining us again today to talk about this topic, infertility and IVF. It's really nice to have you.
It's my pleasure, and thank you for having me here again.
So, I'll start with my first question, which is how do you define infertility?
When a couple has been having unprotected sex, which is well timed for over a year, it is termed as difficulty in conception and needs treatment for infertility.
Mm-hmm.
But since we know that increasing age is associated with a decline in fertility. So if a couple is over 35, we modify this definition to 6 months. That if it's over 6 months, it's time to take advice on how to get pregnant. I just want to point out that infertility is of, primary infertility and secondary infertility.
Mm-hmm.
Primary infertility is when a woman has never ever been able to achieve a pregnancy. And secondary infertility is if a woman has, prior to now, been pregnant at least once.
So, is it only a problem for women or is it a problem for men as well?
As far as who suffers from infertility, 1/3 of the time it's the women who are infertile, and 1/3 of the time it's the men, and the balance 1/3 is either both or it's unexplained.
So, what are the common causes of infertility?
The common causes of infertility, actually, in the female, there are 3 vital biological processes. If there is an interference with any of them, it will result in infertility. So the first one is ovulation, which is a mature, healthy egg being released from the ovary. The second process is fertilization, when a healthy sperm meets a healthy egg in a healthy fallopian tube after traveling through the cervix and the uterus. So that is fertilization. And the third is implantation, which occurs when a fertilized egg or an embryo is able to reach the uterus and stick to the lining and then develop to become a baby. So any hindrance in these processes will result in infertility. So the risk factors that are associated with ovulation problems are increased age of the mother, which causes a reduction in the quality of the eggs as well as the number of the eggs. Now, what also compounds this is smoking, heavy alcohol intake, unhealthy diet, obesity or underweight, exposure to chemicals, heavy metals, chemotherapy, radiation. All these do their bit of damage on the quality of the eggs. Exposure to sexually transmitted diseases results in infection and damage to the tubes and the uterus. There are certain conditions which are associated with ovulation disorders and poor ovarian reserve, and these are polycystic ovarian disease and other conditions that are associated with poor ovarian reserve, premature ovarian failure, and hormone disorders such as thyroid disorders. Cancer survivors also have the problem of poor egg quality. Now, pelvic inflammatory disease and sexually transmitted diseases again lead to tubal blockage. Then conditions such as endometriosis, that impacts the egg quality as well as causes implantation issues. Uterine fibroids distort the uterine cavity and cause implantation problems. Uterine cavity scarring can also be as a result of previous surgery or procedures that a woman may have undergone. So these are all the causes of the female infertility. Then coming to the other 1/3, which is male infertility. And that is all revolves around the production of sperms, the sperm count, the motility, the shape of the sperms, the DNA fragmentation. And again, the risk factors for these problems is older age, smoking, alcohol intake, obesity, exposure to toxins, drugs, chemotherapy, radiotherapy. And all this again causes a defect in the sperm, resulting in infertility. The balance 1/3, which is unknown, well, it could be as a result of immunological causes or certain subtle gene mutations and defects.
So how is infertility diagnosed and treated?
So diagnosis of infertility is a vast topic, but in a nutshell, the diagnosis is made on the basis of a detailed history, examination, and investigations. The investigations that are done for women are check on the ovulation through a pelvic ultrasound, which checks the ovaries, rules out polycystic ovaries, endometriosis, poor ovarian reserve, and cysts, and checks the uterus to rule out fibroids, adenomyosis, any other cavity abnormalities or lining abnormalities. Hormonal tests in form of blood tests to measure pituitary hormones, ovarian hormones, and thyroid hormones. Then tubal patency tests or a hysterosalpingogram, in which dye is put inside the uterus and x-rays done to find out if the tubes are open or not. Then as far as the men are concerned, the semen analysis, and on the basis of the analysis result, other investigations such as their hormonal profile or an ultrasound can be carried out. Then coming to the unexplained. When all tests are normal, then we call it unexplained. And there, sometimes immunological tests will rule out certain dysfunctions, or doing a genetic test to rule out these subtle defects or mutations. So these are all the things that will help us to diagnose the cause of infertility.
So is that true that some of the things could be treated without requiring any assisted?
So the treatment depends on the cause. We have to address the treatment to the cause. And it also depends on the age of the couple, the duration of infertility, and their personal preference. Now, infertility is a complex disorder, and the treatment will all, very frequently it involves a tremendous amount of effort, of physical effort, time commitment, financial commitment. And it is seen that some couples may just require 1 or 2 therapies and they conceive. But while others may require a whole gamut of therapies, and then only can they conceive. If it's an ovulatory problem, then generally medication will help. So fertility medication, and the first line is oral tablets, may help the woman to ovulate and conceive. But if that doesn't work, then injections, hormonal injections are given to stimulate the ovaries. And then when ovulation is successfully carried out, then she will conceive. If this does not help, and there are other conditions like, say, endometriosis or fibroids, then it may require surgery. And fertility restoring surgery is generally done laparoscopically or hysteroscopically or even both. And then you can remove the endometriotic cysts or remove the fibroids or polyps, or if there are adhesions or scarring, you can rectify that. If the tubes are blocked, you can open them. Or if the tubes are irreparably damaged, then you can actually deliberately block them, so that, because when this patient undergoes IVF, then if the tubes are blocked off, it improves the result of IVF. For men, there are certain treatments and drugs to improve the semen count. Sometimes certain surgical procedures are done also to improve the semen part of it.
So if nothing actually works, then what are those assisted methods which are currently available for assisted conception?
So that is those reproductive assisted procedures. The simplest one is intrauterine insemination.
Okay.
For intrauterine insemination, the prerequisite is that the tubes should be open and the semen should be of a certain basic quality. It should not be of a very poor quality. And it is basically a very small procedure where at the time of ovulation, a prepared semen is placed inside the uterine cavity. And this may be coupled with giving drugs for enhancing ovulation so that the results improve.
So how is IUI and ICSI, how they are different from IVF?
So IUI, like I explained, is a very simple procedure. Then the more advanced than this is IVF and ICSI. Now, the difference between IVF and ICSI is that in IVF, after everything has been prepared and the eggs have been retrieved from the woman, in IVF, prepared sperms are placed on the egg in a dish in the IVF lab.
Okay.
But in ICSI, a single sperm is picked up and injected into the egg.
Okay.
The preparation process is the same for both. The woman has to undergo daily hormone injections to stimulate her ovaries. And when the eggs are mature, then the egg retrieval is done in the same way, ultrasound guided procedure, suction procedure. Once the eggs are collected and placed in the dish, then the difference comes in, where either the sperms are placed over the eggs or whether one sperm is injected inside the egg. And then once that happens, then the fertilization happens, which is basically that fertilized egg forms a cluster of cells, which is called the embryo. And then the embryo has to be transferred into the mother's uterus. That is called an embryo transfer, which is the same in IVF and in ICSI.
Okay.
And then after that, if it implants and the woman gets pregnant, she'll get to know after 7 to 14 days. I just want to mention one thing about embryo transfers, that they can be fresh embryo transfers or frozen embryo transfers. A fresh embryo transfer is done in the same cycle as when the egg retrieval is done. And a frozen embryo transfer is not done in the same cycle, but the embryos are frozen, but at a later date, after the uterus has been prepared well, the embryo is thawed and then transferred. And the specialist will decide regarding that depending on the condition, whatever is optimal for a particular patient.
So actually just focusing on IVF right now. So how do you think the couples can actually prepare themselves before, they're going for an IVF treatment?
So a lot of preparation must go on before couples decide to embark on this journey. And that preparation should be both mental and physical. The physical part of it, of course, is healthy lifestyle modifications, a healthy diet, the correct weight, optimize the weight, and then optimization of your sperms and eggs. And how does that happen? By staying away from toxins, by eating healthy, by taking antioxidants, and by going off drugs that may be harmful, and by making sure your vitamin D levels are good. So all these things are the way you prepare your body for it. And mentally, of course, you should be stress-free, and you should engage yourself in some de-stress activities such as yoga, meditation, or any such kind of a thing. And then, of course, not have your hopes too high that the first cycle is going to work. Sometimes the first cycle may not work. So don't be devastated. But this time, the second time, your physician will know how to better optimize your therapy, because now there is an increased awareness of how the body responds. So think of it as a better chance the next time. And be patient and be persistent and be positive.
So just generally speaking, like what is the success rate of IVF?
Well, the success rate of a first cycle is about 30%. And of 3 complete cycles, the success rate increases between 45 to 53%. It depends on the age and many other factors. But in general, if a woman is less than 35, the success rate is on an average 40%. But if the age is over 40, it falls drastically to about 11.5%. It'll be seen that younger women will get pregnant more easily, so their timeline will be shorter, and older women will require sometimes more time to get pregnant. But the success rate, of course, will be, the difference will be there in the success rate.
It's like how many times do you need to try IVF in order for it to work successfully?
Well, it's so individual and variable. Some women will get pregnant the first time, but if you have to give it a fair try, at least try 3 complete cycles, which means 3 stimulations, 3 egg retrievals.
What are the risks which are associated with IVF?
Well, IVF per se has very, very low medical risks. In fact, the risk of going through an IVF procedure is less than a woman going through a pregnancy.
Okay.
So very rarely there may be an anesthetic complication or a drug sensitivity allergic reaction. And almost unheard of is maybe blood loss or damage to some adjacent organ. I mean, I haven't seen that happen, but theoretically anything is possible. And then, of course, the complication that used to be dreaded many years ago was ovarian hyperstimulation, which used to be sometimes life-threatening. But these days, because of improved awareness and knowledge and expertise, this doesn't happen, because you use low doses, you're able to freeze the embryos, and you can go around it so that women do not have serious complications. And certain minor, trivial, temporary things like headaches, bloating, pain in the abdomen, mood changes.
So what are the chances of like having a healthy baby or multiple pregnancies, when you go to IVF?
An IVF conception does increase the rate of multiple pregnancy to 30%. And it depends on the number of embryos you transfer. Although these days the recommendation is transfer 1 single embryo, a healthy embryo, on day 5. And that gives you mostly a single pregnancy. Very rarely a single embryo may divide and become double, and you may get identical twins, but generally it'll be a single pregnancy. But at times for older women, you do put in more than 1 embryo. Sometimes the couple may also want. So in those cases, chances of twin pregnancy is much higher. Yes. And as far as the answer to having a healthy baby, Many studies have shown that IVF babies are not more prone to abnormalities, but this is still a controversial subject, and many more studies are required to shed light on this issue.
IVF, of course, as far as I've heard, it's an expensive treatment. So, what do you think about it? Like the cost of the treatment, is it really expensive?
Of course, IVF is an expensive treatment, and the reason is that the drugs that are used in IVF are very expensive. The gadgetry and the expertise that goes into IVF is also very expensive, but it still is the most effective treatment for infertility, which could earlier did not have any cure. And now it gives these couples hope of being parents. So I suppose the cost is worth it.
So, coming to my last question, do you have any advice for couples who are planning for IVF treatment?
I want to tell them that it is an amazing technology and it gives couples an opportunity to become parents when otherwise there would have been no hope of having their own babies. But it is a journey which should be embarked upon after proper mental and physical preparation. And the physical preparation we've talked about, that it is optimizing your health, your weight, your diet, and having all the vitamins and doing everything that your specialist tells you to do. The mental preparation is being well informed about the whole process so that you are able to give it the necessary commitment that it requires and able to cope with the stress that it entails. And it is important actually to be in touch with a fertility counselor who can help you cope with all the stresses so that the couples emerge from it in one piece and that there is no stress or no damaged relationships in the process of this journey. Since it takes more than one cycle to get pregnant, one has to be patient and persistent and stick it out. And most of all, stay grounded and not lose yourself during this process.
Dr. Urvashi, thank you so much for joining us and answering all our questions. I can say that it was an eye-opening interview and with lots and lots of information. So I'm sure it's going to help a lot of women out there. Thank you so much.
Thank you. My pleasure.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quickmommyhacks, and follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood.